problem gambling and smoking. So that's what they think, and that's what they're starting to do. Now, this is the point in the storyline where one may reasonably assume one of the leading characters posed the perfectly reasonable question, what does the evidence say? Sadly and perplexingly, rarely has that happened. Now, if it did, what would a balanced reading of the research tell us? It would tell us, I think, the following things. Providing rudimentary health information hasn't failed. What has failed is the state's expansive attempt to instill fear in the minds of its citizens about many of their dietary and recreational choices. Serious health warnings are diluted when consumers are deluged by warnings about every imaginable item, ingredient, and eventuality. There's already evidence, for example, that consumers are confused rather than educated by warning labels. Clearly, most of these labels should come with a very simple warning of their own: danger, bureaucrats at work. Prevention has failed to ward off lifestyle illnesses for the fundamental reason that such illnesses are multifactorial, and therefore it's clinically impossible to identify the sole cause of a disease. Consider, for instance, the multiplicity of risk factors for both lung cancer and heart disease, 30 for the former and over 300 for the latter. Consequently, health promotion has failed as a policy tool. Since Canadian Health Minister Marc Lalonde was the first to articulate this health promotion philosophy back in 1974, the central tenets have remained the same. Namely, that science clearly shows that if people are to be healthy, they must change their lifestyles, and it's the public health establishment's role to see that this change takes place, either voluntarily or, if necessary, through coercion. There's little compelling evidence, however, that multifactorial diseases can be prevented, particularly through lifestyle interventions. Respective government-specific lifestyle policies are both unjustified and unsuccessful because they're based upon evidence-free arguments, and therefore these policies never stand a chance of success. The standards of scientific evidence required to justify public health interventions are far, far higher than those employed by public health policymakers. Evidence-light, photo-op policymaking often makes for good media coverage and, at times, good politicking, but it rarely makes for good public health. For example, when will the public health establishment call time on its shoddy alcohol research? Now, to use a British example, and sadly most of the bad examples, the scary examples, are British these days. Ever since the British House of Commons Health Select Committee last summer grilled several alcohol industry CEOs, it's been open season on alcohol, pretty much, especially alcohol advertising. Leading this campaign has been the British Medical Association, whose Board of Science recently called for a complete ban on all forms of alcohol advertising and marketing. Two claims, I think, deserve special attention. First, there's the claim, and further to the previous speaker, observations about research and research funding, there's the claim that researchers funded by government are objective in the debate over alcohol advertising policy because they are, quote, independent, whereas researchers funded by the alcohol industry are dependent. Second, there's the claim that it's, quote, established that alcohol advertising, quote, encourages young people to drink alcohol sooner and in greater quantities. The effect of these two claims is to suggest to the public and to policymakers that first, the debate over the effects of alcohol advertising is over, and second, only those people funded by the alcohol industry question this reality. Now, is this true? You'll be surprised to know that I'm going to suggest to you that it is not. The idea that people whose research is funded unwittingly by the taxpayer are independent and therefore objective in their findings and policy prescriptions is naive at best, disingenuous at worst. The interests of those who claim to represent the public are themselves conflicted and self-serving, and certainly neither independent nor objective. Whoever supports their work, Every researcher has biases which are shaped by their education, their experience, their ideology, and the politics of their profession. In the case of alcohol research, the public health research community is largely supported by a state that is Janus-faced over the appropriate place of alcohol in society, decrying on the one hand, decrying and controlling, whilst happily accepting its share of an immensely profitable undertaking. Are we seriously to believe that researchers from the public health community are unaware of the government's positions on alcohol when they undertake their research? Indeed, they approach their research for the state knowing the policy outcome that will please their patron in the same fashion as an industry-supported researcher does. The recent British controversy involving Professor David Nutt, who many of you will recall was chair of the UK Advisory Council on the Misuse of Drugs, who was fired by the British government following his challenge to the current drug classification scheme, shows that the British government, at least, neither wants nor appreciates policy-neutral, independent science. Since all research, except for the rare independently wealthy researcher, is funded by someone, the fact that research is funded cannot by itself be taken as a reason for rejecting it. This suggests that the public health establishment's real objection is not to the funding of research, but the fact that some funding is by good funders, that is, funders who guarantee independence and objectivity, and some funding is by bad funders, that is, funders who demand subservience and bias. Consequently, government-supported research into alcohol, for example, is good by definition. Industry-supported research is bad by definition. End of story. But the history of alcohol policy research disproves this. To give you one critical example, there's such a thing as the Framingham Project. It's a multi-generational American epidemiological study that the US government financed. And it found early on that there were significant positive benefits of moderate drinking, benefits particularly noticeable with regard to heart disease. Yet the government, the US government, denied the study's key researcher permission to publish these results because they would be, and I quote, socially undesirable in view of the major health problem of alcoholism that already exists in the country. Now, it would be difficult to describe the government-funded research that formed this project, stripped of the evidence that moderate drinking conveys a health benefit, as good by definition. Therefore, the issue isn't the simple-minded one that industry-backed research is suspicious because it's industry-backed and public health research is honest because it's supported by the government. Both kinds of research have the potential to be shaped by the interests of their funders, and both begin with biases, conscious or not. To simply reduce research into two piles, good and pure versus bad and corrupted, on the basis of funding is to be, above all things, intellectually lazy, since it avoids the hard question of the quality of the research itself. Further, it's an attempt to introduce a scientific ad hominemism in which research from the wrong people, funded by the wrong sources, is dismissed out of hand. Indeed, this is the exact intent of those who accept the official line, as well as the position of many in the public health community. Rather than evaluating each piece of research on its individual merits, evidence which doesn't fit what the public health community wants to hear is simply dismissed or ignored on the grounds that, as I've suggested, it is done and funded by the wrong people. In short, the supposed consensus about alcohol advertising, consumption, and youth drinking, repeatedly cited in the mainstream media, is produced not by any genuine agreement by researchers about the evidence, but by simply ruling out certain pieces of research and evidence that are inconvenient for the public health establishment's group think. As a case in point, at the Democracy Institute, our new research on the connection between alcohol advertising and youth consumption and overall consumption in the UK is shortly to be published in a peer-reviewed journal.